Acute lymphoblastic leukemia. All causes and pathogenesis. Acute lymphoblastic leukemia (ALL) is a type of blood cancer that occurs when immature white blood cells called lymphoblasts grow and multiply abnormally, crowding out healthy blood cells. While it can occur at any age, it is most common in children. One causes. The exact cause of ALL is unknown, but several factors may play a role in its development. Genetics. Some individuals have a higher risk of developing ALL due to their genetics, such as those with a family history of the disease or those with certain genetic syndromes. One causes. Environmental exposures. Exposure to certain environmental factors may increase the risk of developing ALL, including radiation. Exposure to ionizing radiation can increase the risk of cancer, including ALL. Chemicals. Some chemicals, such as benzene, have been linked to the development of ALL. One causes. Viruses. Some viruses, like Epstein-Barr virus and cytomegalovirus, have been suggested as potential risk factors for ALL. Radiation. Exposure to ionizing radiation can increase the risk of cancer, including ALL. Chemicals. Some chemicals, such as benzene, have been linked to the development of ALL. One causes. Viruses. Some viruses, like Epstein-Barr virus and cytomegalovirus, have been suggested as potential risk factors for ALL. One causes. Population mixing. This hypothesis proposes that exposure to common non-disease-causing infectious agents from carriers can trigger the development of ALL in susceptible non-immune individuals. However, this doesn't explain all cases of ALL, especially in adults. One causes. Radiation. Exposure to ionizing radiation can increase the risk of cancer, including ALL. Chemicals. Some chemicals, such as benzene, have been linked to the development of ALL. Viruses. Some viruses, like Epstein-Barr virus and cytomegalovirus, have been suggested as potential risk factors for ALL. 2. Pathogenesis. The development of ALL typically begins with a single lymphoblast that acquires a mutation. This mutation causes the cell to multiply abnormally and to evade the normal cell death processes. Apoptosis. These mutated cells accumulate in the blood and bone marrow, displacing healthy blood cells. 3. Genetic alterations. Acquired genetic abnormalities are a hallmark of ALL, found in about 80 of cases. These alterations include chromosome number abnormalities. Ploidy. The cancerous cells may have more or fewer chromosomes than normal cells. 3. Genetic alterations. Chromosome structure abnormalities. Chromosomes may be broken, inverted, or translocated. Chromosomal translocations are particularly common in ALL, for example, T119 TCF3 PBX1 or E2A PBX1. This translocation is common in children and often occurs after birth. 3. Genetic alterations. T922 BCRABLA1. This translocation is more common in adults and creates a fusion gene BCRABLA1 that codes for a cancer-causing protein. 4. Classification. ALL is classified based on the type of lymphocyte affected. Cell ALL, the most common type, accounting for approximately 85 of cases. Cell ALL. This type is less common and more frequent in adolescents and adults. 5. Note: while the risk of ALL is higher in children, the disease can occur at any age. ALL is a serious disease, but with advances in treatment, survival rates have improved significantly. The disease can be treated with chemotherapy, radiation therapy, and bone marrow transplantation. 6. Research. Scientists continue to conduct research to gain a better understanding of the causes, pathogenesis, and more effective treatment methods for ALL. The goal of these studies is to improve survival rates and reduce the side effects of treatment. Additional information. ALL is a heterogeneous disease. This means there are many different subtypes of ALL, each with its own unique characteristics and prognosis. Additional information. Treatment for ALL is highly individualized. The specific treatment plan for an individual with ALL will depend on several factors, including the patient's age, overall health, and the subtype of ALL they have. Additional information. There is ongoing research into novel therapies for ALL. These include targeted therapies that specifically attack the cancer cells while sparing healthy cells, as well as immunotherapy, which helps the body's own immune system fight the cancer. Additional information. The information provided here is for general knowledge and informational purposes only, and does not constitute medical advice. Consult a qualified healthcare professional for any health concerns or before making any decisions related to your health or treatment.